Hi, I'm Jeanne Schumacher, and I am co-founder of the Pregnancy Advantage, and my partner is Dr. Debra Shapiro. She's a board-certified OB-GYN. Today on our show, we are going to be discussing a vegan pregnancy. And I'm so excited about this because we have a very special guest. Her name is Laura Marks. She's been a vegan for 35 years. She is a vegan childbirth educator and a birth doula. She's also a massage therapist and does a lot of other body work and hypnotherapist in the in the mix. She also had a vegan birth in water with her son, who is now 24. So thank you, Laura, for taking the time to be with us today.
Thank you so much for having me. I'm very excited about this.
Well, Debra, you're ready to rock and roll today?
Absolutely. I'm very excited to be talking to Laura. I really love doulas. And I actually want to start out because I think asking you to just talk about what a doula is and what a doula is trained to do, because I think a lot of women may not really know what a doula is, and they may not have access to them. So take it away, Laura. Tell us what, or even what, describe a day in the life of a doula.
Okay, well, I'm going to tell you, first of all, doula comes from the Greek word meaning servant. And so the big picture is that I serve women and their partners and their families. And there are a couple of different types of doulas. I'm a birth doula, which means that from the time somebody hires me in their pregnancy through the time after they have their baby, a little bit after, I support women in their physical, emotional, mental, and spiritual well-being, as well as their partner and the family. So when a mom hires me, whether or not she has a partner, I'm committed to educate her, and I'm committed to give her information that she asks for and maybe she doesn't. Even if it's her first birth or her 10th birth, I'm here to help her and to guide her and to listen. That's a lot of what I do. Is I use great listening skills and talk to her about what is it that she wants during her pregnancy? What is it that she looks for? What's her vision of her birth? And what does she want afterwards? We do talk about support postpartum because my belief is that our birth culture, at least in the US, we do a horrible job of postpartum. So I focus on that for a good deal of time as well.
Excellent. Can you talk, do you have a memory of when you first met a doula or knew what a doula was, or how you became interested in becoming a doula yourself?
Yes. So I first learned about doulas when I was taking my Hypno Birthing childbirth education training over 18 years ago from Marie Mongan, who is the founder of the Hypno Birthing Institute, and she has since passed, but she founded the Hypno Birthing Institute in the early 90s. And I did my training, as I said, a while back. And as we were talking about the birth process and how a woman could best be supported, that's where I first heard the term doula. And so from the very first class I taught of hypnobirthing, I suggested that women have a doula present, because a doula and a midwife and an OB are different things, and they do overlap, but it is helpful no matter what setting, because I support women in a hospital setting, in a birth center setting, as well as home birth.
Fantastic. So now you mentioned something else. You mentioned hypnobirthing, and I'm not sure that people really know what hypnobirthing is. My sister-in-law actually used this technique, and it was amazing. So she didn't need any medication, and she was really pretty sort of blitzed out, numbed out. And I was wondering if you could talk about that.
Hypnobirthing, yes. Hypnobirthing is a childbirth education program that focuses on the normality of birth. It's a 5-class series, in case people wondering how long do I do this. And each class is about two or 2.5 hours. And we teach a complete childbirth education from the stages of labor. We talk about pregnancy. We talk about positioning. And we also talk about the fear, tension, pain cycle of, and how birth does not have to be painful, and how to avoid interventions, and what is normal, what is on the scale of normal, how partners can support the mom. We also talk about emotional, mental states and relaxation and hypnosis, and what hypnosis is and is not, as well as a little bit about nutrition. And in my hypnobirthing classes, I will take time outside of the class to talk about a little bit more deeply about nutrition, because they're very picky about what I teach. And if it's not on the curriculum, I'm not allowed to teach it in the class. So I do a little outside the class talking about optimal food and optimal nutrition. And I talk about postpartum, and I talk about a little bit about nursing, and also about hypnobirthing really is a complete childbirth education. And I even say, even if somebody is planning a C-section for medical reasons, hypnobirthing can help. So no matter what it looks like, these are tools and techniques that are very, very helpful from a non-medicated birth through a medicated birth.
Fantastic. I was just going to ask you whether your childbirth education class or your hypnobirthing education classes could sort of substitute also for sort of the standard kind of childbirth education, but you answered that it can. That's fantastic.
It can, and often I have people call me and say, I'm planning to take in so-and-so childbirth class, and I very much dissuade them, because many other childbirth classes focus a lot on pain. That's a big focus. We do not focus on it. We don't say we guarantee you a pain-free birth, but we don't focus on the pain. We do talk about how to have a calm, comfortable, gentle, empowering birth for the mom.
Very nice.
Yeah.
Can you compare your classes a little bit with the Bradley method? Because I worked with a midwife who was a proponent of Bradley, and we had some of our patients who did very, very well with it, and some didn't. They felt like it was a little too harsh. But I feel like yours is not quite like that. Do you?
So think? For my own personal birth, I did take a Bradley childbirth education class. I was already a hypnotherapist, and I can say that hypnobirthing, I used hypnosis more in my labor than I did any of the Bradley pieces. Mm-hmm. Not to say that Bradley isn't good. It's also called husband coached childbirth. And one of the things that hypnobirthing emphasizes is language, because Marie Mongan was a teacher, and we feel that language, words are power. And so I have a hard time with the husband coach part, just the language of that. And Bradley does go into depth about nutrition. It's a big part of that, the brewer diet. And I had a big discussion with my Bradley teacher, because she was very animal food based and believed that you have to have a certain amount of protein, which is true. There are protein guidelines, I believe, but there wasn't a lot of talk about plant-based eating. So
I never knew that, Laura. I didn't know that, because I think when I was practicing a lot of my obstetric, I just never knew that Bradley had anything to do with food or meat eating. That's so interesting.
And it depends. Yes, it depends on the teacher, because they'll say, oh, you want to make sure, I hear protein, and we're supposed to bring to class, everybody brought a dish at different times. And, I made sure that I taught them about, or at least made an example about what I was bringing, and how plant-based, how calcium and iron, especially this iron thing. I hear so many women say, my doctor told me I had to start eating eggs or beef because my iron was low. Yeah.
Well, iron needs do go up substantially in pregnancy. They go way down with breastfeeding, which is interesting. I was just reading in the 2020-2025 dietary guidelines, which is just coming out, that they're concerned about women using prenatal vitamins that have a lot of iron after delivery, because you don't need that much iron. Unless, of course, I mean, what I found was a lot of women, there's a problem with women having obstructed labors, partly from having babies that are very big. They come in, they're already big, they're gaining a lot of weight, the babies are big, they're having obstructed labor, they need C-sections, they have hemorrhages, and they actually leave the hospital anemic, so they do need extra iron. But in general, iron needs are up in pregnancy, but down afterwards. So, but yes, this whole idea that you could have a vegan pregnancy and be safe. I mean, of course, it's accepted now by our Academy of Nutrition and Dietetics, absolutely. And the dietary guidelines is talking about pregnancy and pre-pregnancy and postpartum and infant care for the first time, infant nutrition. So I think that Jeanne's was going to be asking you more questions about being vegan through your pregnancy, and I'm excited to hear about that too.
I know you've supported a lot of women who went through their pregnancies as vegans. So can you share some of those experiences? What were some of the benefits? I mean, things that you saw along the way?
Yes, most of my mamas who are vegan, I didn't have to go through, I asked all of my moms whether they're taking my class or whether they're a doula client to at least send me 2 weeks worth of food and drink diaries. And rarely did I have to make suggestions with the vegan mom's nutrition. They usually were very focused on making sure that they had correct amount of food. A lot of pregnant moms don't eat enough. It's the most interesting thing, especially in first trimester, if they have any kind of morning sickness, and they can't tolerate things. And what do they do? And a lot of times they get told by their physician, I keep saying this, or even their midwife, that they aren't eating enough. So maybe they could eat something that's an animal product, that it would make things easier. So the vegan moms often will say to me, this is what's going on, and I'm only able to stomach this, but I have no problem figuring out what I should eat. And usually their labors are a lot easier. Their babies are no smaller, no bigger. They run the gamut. And a lot of times we have discussions about gestational diabetes. Debra, I'd like to hear your take on this, but what I say is, you can't change that. You can still eat a great vegan diet, but a lot of it is hormonal and sometimes genetic, but that's some of what we talk to. But I find a little bit better outcomes. It's not hugely significant, but I do have better outcomes. And moms are definitely a lot more educated and tend to want to know more about how they can have a better birth and be a better parent.
Just jumping in about the gestational diabetes, this study showed that plant-based people are definitely going to have less insulin resistance, and I think there's going to be less gestational diabetes as well. They're going to start out at a more normal weight, because we know that vegans, plant-based eaters are going to be more normal weight, and they're probably going to have less of an excessive weight gain. So all of this is going to be improving their chances of not having gestational diabetes. But I agree with you. What I was taught, of course, was that it's just these extra hormones, the placental lactogen, right?
Yes.
Human placental lactogen, that raises your blood sugar, and you just can't, and that's true. And it's certainly even more if you have twins, right? With more placenta, but the insulin resistance is the other side of that. But I agree with you. I mean, some of this, it happened when you were in your mother's womb. We've been talking about epigenetics in our program, and in these discussions, that if your mom was exposed to certain chemicals and you were exposed to certain chemicals in the womb, you would be more predestined to have diabetes. So all of this, and of course gut bacteria plays into it, so it's multifactorial, right? Yes. But certainly if you start out at a normal weight, you really have reduced your insulin resistance by eating a plant-based diet and reducing that intramyocellular lipids that are clogging up the insulin receptors we've learned from Neil Barnard, then you're going to be much less likely to have any problems with glucose intolerance in pregnancy. And some of it we just can't control. So, but when I was at Kaiser, when they were teaching people who had gestational diabetes what they could eat, it was still about, you can't have beans because they're carbs, and it was very, very, very tricky. And even in the dietary guidelines, they still put lentils and beans as a vegetable and not as a protein food. So it's a little confusing to me. But so you would say that you didn't see less,
I did.
You did see less gestational diabetes with your
absolutely.
Yes, I mean there should be, and less. My goodness, less hypertension and less preeclampsia, right?
Oh my goodness.
Yeah,
I've had no vegan that's had preeclampsia.
Right, and that was what that the famous midwife from the farm saw also. Ina May Gaskin, right? I think there might have been one in 1,000 births or something. It was very, very low risk. And boy, when I was later in my pregnancy, in my work as an OB, it just seemed so common that women, not only would they develop preeclampsia, but they were starting out very early with hypertension. And not only because they changed the guidelines, but also they very early in their pregnancy, by 10, 12 weeks, practically by the time they got in the second trimester, their blood pressures were already going up. And that's because of the food.
Of course. Yes. I have to say, it's interesting because I've seen a change, and I'm not sure exactly what it is, but lately, I guess in the last several years, I've seen more late preeclampsia than I have before. I'm not sure what that is.
No, like postpartum too? Like postpartum, people coming back?
No. Like in the after 35 weeks, something will shift. And they'll say, I've seen, I went to my doctor and my blood pressure was up, but I don't know. And then they'll hit, all of a sudden preeclampsia will hit at like 38, 39 weeks.
Right. And then they'll have to be induced.
And then, exactly.
You just get onto that treadmill. It's so awful. Right. Yeah. And this is what we're trying to stop, because I believe if people get healthier before, we know this, that there'll be less preeclampsia, there'll be less hypertensive complications in pregnancy.
Correct.
Less hypertension, right.
Yeah. And then the baby, if they have a larger size baby, they will, they have to do heel sticks on this baby and, more invasive procedures on the baby and watch their sugars. And then, they'll be recommending sugar water or gel or formula. And there's no quote unquote vegan formula in the States.
Is there in Europe? Is there something good in Europe? Somewhere else?
There's something in Europe, and I can send that to you. But once again, do they recommend donor milk in all hospitals? No. We're very lucky in this area. We have many hospitals that will offer donor milk. And, I would...
Can you just explain why someone would need donor milk?
If the practitioner is saying your baby sugars are low, and that's when they test the baby sugars, they will often recommend some kind of supplementation other than the mom's colostrum until she gets her milk. And so sometimes it is the sugar water or gel, but they could offer, if the hospital is great or good, decent, they will offer donor milk. And I would say, I've said this to vegan and vegetarian moms, they said, well, what if the mom isn't vegan or vegetarian? And I have said, you have to make up your own mind. Yet I would choose as a vegan, if I had a choice, I'd take the donor milk of a non-vegan over formula. Because once you get formula, the microbiome is never the same. You can't turn it back.
Are there studies about that actually? Because I don't know if I know people say that about antibiotics too, but I don't know if it's really been shown that you cannot ever get a healthy microbiome.
So you could get a healthy microbiome, but it's never the same. It's not the same. It's changed. And I will ask my astute lactation consultant, who's also a pediatric surgeon, about studies that she can send me.
Okay. Because that's a scary thing to tell a mom, because sometimes there may be no option. I get this also when people have Group B strep. They're carrying Group B strep, and we recommend that they get antibiotics because Group B strep can kill babies. And they say, wait, that's gonna kill off it's gonna change the microbiome forever. And that's a huge thing. to have an argument about.
Right. I don't mention that to the mom about it's never going to be the same. I don't say that unless she's another birth worker, something like that. What I do say is these are, I sort of rank, okay, breastfeeding, donor milk, I go down the line. This is optimal. This is the next. This is the next. So the last thing I want to do is put fear, because in hypnobirthing, we work with eliminating fear.
Right.
So,
right.
And, if a mom is group B strep, what I offer, in addition to the antibiotics, is that she can take probiotics right after or in between doses of the antibiotic within a couple of hours on either side. And that will help. And if she doesn't want to do that, she can put in the probiotics and prebiotics after. So that's the best thing. And, I always suggest that moms go to Evidence-Based Birth website, because they have such great information, and it's evidence-based birth for a reason. So yeah.
Fantastic. Good. And we always recommend nutritionfacts.org also,
Yes.
any information about probiotics versus prebiotics. So fantastic. Thanks for explaining about all of that to our viewers. Thank you.
Well, you raised your son as a vegan, and how was your pregnancy?
I always say, if I had the support and the money, I would have been pregnant more than once. Pregnancy was one of the best times in my life, as far as how I felt physically, mentally, emotionally. I was fortunate not to have any HG, no morning sickness, not a drop of nausea, as did my mother. My mother had none of that. So
HG, hyperemesis gravidarum, just for people.
Yeah, I put that in so you could throw that.
It's a very serious complication in pregnancy where people are very nauseated and vomiting, and really sometimes actually need PICC lines, IV fluids, and it can be very, very serious. Not usually seen in vegans, however.
True. It is very serious. And that's the other thing about a doula. I have moms that can call me at any time when they can't reach their doctor, or they feel like maybe I could have the answer, or send them to somewhere that can. So I did a lot of things. To answer your question, I was very active. I was doing body work and massage therapy. I did not carry my table in and out of people's homes, though. If they wanted my table in, they had to get it in their house. I worked on the floor a lot. I had a shiatsu mat that I worked from. So that was the only change. I did pregnancy yoga, deep water running, other water exercise, swimming. I walked and worked out and was not only very active, but my meditation practice was awesome. It was consistent. And I would say that, the pregnancy, I had my son at 38 weeks and 2 days. So I was a little different than a lot of first-time moms, which we often say first-time moms will usually go past 40 weeks.
Usually a week late, yeah. So that's great.
So I was just a little different. I had my baby shower, and the next day I went into labor.
Wonderful.
I was
Can you say, have you noticed anything? Because I've only taken care of a few patients who were vegan, really, honestly. And the ones that I did, just perfect, like perfection, before their due date or right at a perfect weighted baby, perfectly lovely delivery. I mean, really, but it's an N of a couple. So I was wondering, since you've seen quite a few, would you say that most of them actually don't go past their due date and need to be induced?
I would say most of them are pretty average, like around their due date. Some of them go over. So I don't see induction a lot in my vegan mamas.
That's cool. Do you use dates? Do you ever use dates?
I did not, but I have passed it along in the last probably 8 years. It's not.
Well, okay, what's going on with the dates? Tell me what's going on.
It's so cool. There has actually been randomized blinded controlled studies out of Iran comparing the use of dates versus, not dates, something that maybe tastes sweet but isn't a date, to help ripen the cervix, to avoid inductions and the need for long inductions of labor. So you don't start eating your dates. We're talking about maybe eating like 6 dates. It's a lot of dates, actually. Maybe it's like 4 to 6 dates, but it's started about 37 weeks. I wouldn't start really preterm like before, but you could start right at 30. Do you start at 36 or 37 weeks?
I've started around 37. I leave it up to the mom. I said, if you feel like you want to take during your 6 week, a couple of dates a day, that's fine. But usually because of the sweetness, they don't want to really do that.
Right. It's a lot of dates, right? It's like 5 or 6 dates. So yes, and they've actually shown that it works better than placebo. It absolutely helps to ripen the cervix. So I just learned that pretty recently also. But I was also I've been telling patients to do that as well. And I think
I've never heard of that.
Yeah. So it's just coming on the scene for people, for the general public is just starting to be aware.
It came out of Iran, research from Iran. Very cool.
Yeah, exactly.
Yeah.
So it's midwives have started to really say to mamas, okay, this is what this is, and you can do this. I see it working a good deal of the time, and then again, once again, sometimes it's just that's not it. It's interesting because I think back to like first time moms and moms that have, or what we call primates who've had a baby. That's also a whole different piece of the pie. People that are on subsequent pregnancies, their behavior is a little bit different. And what I mean by that is if they're a vegan mom and they already have a child or more, they tend to not be as vigilant sometimes as a mom who is just focusing on one baby that's not here yet. So,
well, I'm going to jump in because Sisson Robin made a comment, and thank you, Sisson, for joining us today. She said, my son had issues with sugar. I was offered donor's milk. My concern wasn't never about the donor's diet, but more so their health. And I was assured that all the donor's milk is screened.
Correct. It is screened. And usually if someone is donating, they are very good about making sure people know if they're taking whatever they might be taking, even supplements, they will notate that, even if it's something as simple as B12. And they will say, I'm gluten-free, I have allergies to this. So donors are pretty good, I have to say, about notating what it is and what they're taking. And
also, people aren't using donor milk for long periods of time. Like I'm thinking about iodine and things like that are very important to be in the milk. But we're just talking about a short period of time that someone's going to be using donor milk. I don't know whether people are using donor milk long term, because then it would become very important about what what the nutritional status of the mom was.
Right. So if it's a short thing, of course not. The other thing is, it's interesting. I would say, and I'll bring this up, Debra, and I don't know if you have this case of as far as moms that do not have, or moms that have adopted and you probably don't see them, and they're talking about, I have to have formula or donor milk. And I encourage anybody that asks me to let them know that they can lactate.
Yes.
Even if you have not been pregnant.
Yes, we've accomplished this. Absolutely.
Yep.
There was a product called domperidone.
Yes.
So I have given that to patients. I have a whole packet on that. But yes, I'm not practicing obstetrics anymore, but it's absolutely true. You just need a little preparation. It's not something you want to start after the baby comes to you. But if you have some time to prepare, absolutely.
Yes, because I have a friend who adopted from China, both of her children around 3 years old, and she felt so strongly that because they were in an orphanage, that she lactated and gave them for a year.
That's
her breast milk.
Wow.
So she wasn't vegan, but guess what? She is now.
Oh, that's great.
Her kids are like 19 and 20.
Fantastic. I want to talk, we have some time left. I really wanted to get to this because it was something that I really wanted to bring to our hospital, and there were some technical issues. So, but I know that you actually had a water birth, used the Le Boyer method and had a birth in water yourself. And, you know, it is a dream for a lot of women. And in California, we support labor in tubs. And I think, I know at Kaiser also, we're allowed women to labor in tubs, but really we're supposed to get them out and not deliver in the tubs. And that's because of some worries about aspiration of tub water, which I guess happened at UCSF. And so they put the kibosh on it. But actually, it's been used successfully for probably thousands and thousands of births. So can you tell us a little bit about what that experience was like for you?
I birthed in water. I had it in my head because I told Jeanne the story about, I worked for a chiropractor back in the day, and he attended a patient of ours. He attended her birth, and it was a water birth, and they filmed it, and I saw it, and it stuck in my head. And I birthed in a watering trough for animals because I wanted something deep that I could submerge as much as I could. So as soon as I got in that water, it was a game changer for me. And, you know, I was using hypnosis and relaxation. So I didn't feel excruciating pain. It was just uncomfortable enough for me to say, okay, I'm ready to submerge up to my shoulders. And I got in there and my whole body, my whole torso just relaxed. Now, I do want to back up and say Hypno Birthing is not Scientology birth. This is not quiet, silent. We don't, you know, I tell women, please tone. And so I toned. I certainly toned when I felt that would help. But I feel that, you know, me being in water, I had enough room to move around back and forth in the tub. And when my son came out, I feel that it was a more gentle entry into the world for him because it was aqueous to aqueous. And as long as that cord is pulsating, then it's safe. Now, one of the hospitals, the George Washington University Hospital in DC, allows water birth, except now during COVID. But the time that you cannot is if there's a good deal meconium. Right. Then mom has to get out. But
I also gave birth to my children in water. Well, the first one I started in water, and then she got stuck in the chute. So, you know, we had to get out. And then I did the pregnancy chair. But the second one I gave birth in water. And if you ever have the opportunity to have the experience, I can't say enough about it, because as soon as you get into that warm water, because you're trying to they tell you, relax your body so that you can, start. Yeah. Oh yeah. Right. These racking pains are going through you. How can you relax? Well, as soon as you get in water, it's like, oh, Calgon, take me away, man. And it's awesome. I cannot say enough about it. I mean, they kept the water, warm, and it was just so relaxing, and it made it so easy to give birth. And they took him out and put him immediately on my chest, and there were no issues. So I recommend it highly. But
how can you just tell us, how can people get in touch with you, and how can they work with you? And
right now I'm working on a website, so that's not ready yet, but they can email me at touchingspirit1, that's the numeral 1, at gmail.com. That's touchingspirit1@gmail.com. And as soon as the website is ready and my Facebook page is ready, I will send it off to you ladies, and you can pass that along.
Yes, thank you.
Absolutely. We have one last question before we shut off. She, from Sis and Robin, she says, another question: if already breastfeeding your first child, and when you have another baby and the new baby comes along, does colostrum come for the new baby?
Yes, it does. Absolutely, it does. Our bodies are so well designed that she will get colostrum, and then she can tandem nurse if she wants. You can also, you can sustain a twin pregnancy on a vegan diet. I want to throw that in. I'm sure Debra will agree. And you can tandem nurse on a vegan diet. You just really have to, just like anything else, please hydrate. people need to hydrate, and that doesn't mean caffeinated tea or coffee so much, and calories, because that's some of the things that one can cause preterm labor. And also, my son, I wanted to say one thing about weight of babies. So my son was pretty average on the lower side of average, but I was 5 pounds when I was born. So my son was 6'12", but 22.5 inches long, my spring bean. But a friend of mine a long time ago, she's vegan, her husband's vegan. He's like 6'5", she's over 6 foot. Her first baby in the hospital was almost 10. Her second baby at a birth center was 10.5, and her almost 11, I'm sorry. And her third baby at home, 11.6. No diabetes.
Right. No, absolutely. And if somebody's tall, I don't know what her foot size was. I don't know if you use this, but I would normally tell patients that you can usually deliver a baby vaginally that's one size bigger than your shoe size.
Love that.
Is that, so if you wear an 8.5, you could probably have a 9.5 pound baby. Is that what you were taught? Well, you ask your midwives, because I've always worked with midwives, always. In all of my practice, I always had midwives, and I learned so much from them. And I really, and one of my midwives actually, I know she's watching, but she moved to the islands, to St. Thomas. Actually, I think she was on the smaller one. Anyway, she had a tub birth with 2 midwives at home, and had a 10-pound baby in a tub in an island, where it would have been hard to get to. Anyway, she was amazing. And she trained in a birth center in Monmouth County, New Jersey. People did not have access to, epidurals on demand and all of that. And she was really a proponent of, like, you can do this. And people she had such a love connection with her patients. They just adored her. The nurses,
Yeah.
I love the nurses too. They're all amazing, but sometimes they were sort of at odds. I love to help women through labor, though. This is such an incredible time. It's such a powerful time to watch women be able, it's an exorbitant amount of energy and power that you see in that room happening, and it just doesn't happen. It's like an explosion. It's sort of beyond compare. So it's such an honor to be able to be with women during that time. And
thank you so much for your work, Debra. With those women, I have to say that, people will say, OBs don't take any classes in nutrition. And, when you go to them, that's the complaint of a lot of the vegan women that I work with, is if they're with an OB and they ask a question, they don't get good nutritional information.
No, eat more protein. I'm having an old patient of mine, actually, and she may be watching, but she's wonderful. And I'm sort of just casually helping and talking to her and supporting her. And it's appalling. I hate to say it, because I have a lot of colleagues, and, they're on Facebook too, but they don't know, because they're not being taught. And so they're still saying things like, well, you should eat some meat, or you need more meat, so it's very sad. It's very sad, but we're really trying to change this. And
that's right.
So, yeah.
Yep.
Well, not just from the food aspect of it too. We want to get the toxins out, because that's my big passion, is environmental toxins and what we're being exposed to. So, Laura, thank you so much for taking the time to be with us today.
Thank
Debra,
you.
always a pleasure. Totally. And we'll have to have you back again, because we could talk all day, honestly.
Thank you.
Thank
I would
you.
love to.